All right, guys, we have a great show today. We're going to discuss how do you know when stomach pain is serious. We'll discuss the most common foods that causes bloating. I know you're looking forward to this. And we'll discuss the differences between prebiotic foods or prebiotics and probiotics and all your questions live on today's Poop Tip Tuesday, guys. Let's talk about poop. Hey guys, my name is Dr. Samir Islam. My passion is to give you tips and tricks to help out with your gut health. I grew up in a small town called Odessa, Texas. You may have known that from the movie Friday Night Lights or even the TV show. I did my undergrad at the University of Texas at Austin, go Longhorns, and I did my GI fellowship training at the Mayo Clinic. So guys, let's talk about poop. All right, we have a great show today. Happy May! Yes, it's the beginning of May. I can't believe summer vacation is almost going on. Let me know if you guys have any plans to go anywhere. I know it's been about 2.5 years since I traveled anywhere, and so I'm excited to go on trips. I have no idea what we're doing, but I know I'm going to be doing something. If you're joining for the first time, my name is Dr. Islam, and yes, I am your poop guru. Every other Tuesday, I go live to answer your questions you guys may have about anything related to your health. If you haven't already, don't forget to smash that like button, like, share, and subscribe, and share this live stream to all your friends, your family, everyone in the world, so they can join us on our Poop Tip Tuesday. I need a huge favor from you guys. If you can let me know if you're watching this live or on the replay, and also let me know where you're watching this at. And if you have a question for me, put it in the comments down below so I can answer those in between my topics I have today. We have 3 great topics today. I hope you guys are doing well. It's a beautiful day in Lubbock. I actually enjoyed today's day. And these past couple of days have been pretty good weather. I'm really excited for that. Eric, thank you for watching on the live stream. Let me know where you're watching this at as well. All right. So a couple of updates. Number 1. You may have seen I have a new camera, not this one, but on my YouTube channel. So I have a couple of cool videos coming up. I'm going to do a reaction video. Stay tuned for that. I'm looking forward to that as well. What else? We set up a little bit of a new studio here, so that'll be coming up pretty soon as well. We have some exciting changes we're going to have for our clinic, which I'll tell you about. We're starting a little infusion center here. We'll be talking about that pretty quickly in the next couple of weeks once we get that revved up. But if you're interested in getting some IV therapy or the medications, come look at my Lubbock Gastro website as well. Books I am reading. So I have just started this new book called The Founders. It is basically the founders of PayPal. I just started it, but you can already see these pages that are kind of marked over. This is how I take notes in books. And so I've been on this run now of trying to read a lot of books on how businesses have started, just, with me opening up my own practice. Let me know in the comments down below if you have any recommendations for me for some of the books that you think I should read. But I don't know, it's what I do with my time, guys. Hope you guys are doing great. Eric, thank you for watching from Lubbock. Ramon from Carlsbad, thank you for watching from Carlsbad. Alex, good seeing you as well. Joy's good seeing you from Lubbock. And Alex, I'll answer your question. Very great question. I will answer that very, very quickly. All right. So we have 3 great topics today, and any questions you guys may have as well. As usual, put them in the comments down below. All right. Question number 1. Hey, Dr. Islam, I have stomach pain. How do I know if it's serious? So let me know in the comments down below. Have you wondered this? Do you wonder, this pain, is it something that I should worry about? Now, we all have pains, even poop gurus. We have pain as well. Yes, we suffer from gastric pain. Absolutely, it happens to all of us. And some pains, they come and go. Not a big deal. But there's some pains which could be a sign of something bad going on inside your GI tract. So I'm going to give you 5 things that I look for to make me think that something bad is going on. Now keep in mind, this is not a comprehensive list, but these are things that I kind of keep an eye out for that I wonder if a patient has that makes me think something else is going on there. Number 1, if you feel like this pain is the worst pain you've ever felt in your life. Now, we all have different degrees of pain. Sometimes pain, not a big deal. But if this is 10 out of 10, severe pain comes on all of a sudden, it's the worst pain you've ever had in your life. This is something that is serious and should not be ignored. Don't ignore pain like this, because this pain could be a sign of something bad going on inside your stomach, inside your colon, inside your GI tract. Do not ignore that. Number 2, if you start to notice that your appetite's getting worse or you're losing weight, these are never normal things. Look, we all want to lose weight. I understand this, but you don't want to lose weight this way. So if you have pain associated with weight loss, or you're just not eating as much as you used to, your pants are getting smaller, or your portion size are getting less, that is a sign of something bad going on inside your GI tract. Number 3, you have bleeding inside your stools, whether it's black stools, bloody stools, red stools, maroon stools, any spectrum of red, that is not normal. That is very worrisome for me. Don't assume that bleeding is just from hemorrhoids. No, it's not. Especially if you have pain with bleeding. Don't ignore that. If you're having issues, make sure you get that taken care of. Number four, you have a new change in your bowel habits. Pain with a different change in your bowel habits is not normal, guys. So what this means, let's say you've always been constipated, then all of a sudden, hey, I'm regular now, or I'm having diarrhea, or even the opposite way. Let's assume you've always been having diarrhea, and all of a sudden, hey, I'm now constipated. I love it. No, don't love that. If you have pain associated with a change in your bowel habits, that could be a sign of something bad going on. And then lastly, pain with fevers or chills could be a sign of an infection, irritation, or something bad going on. These are 5 signs that could be a sign that something bad is going on inside your GI tract. So what do we do as a GI doctor to help evaluate what is going on? There are 3 things that we can do to see if their stomach pain is serious. Number 1, we may get routine blood work. We can test for stool studies. We can check your blood count to see if you're anemic. We can check your pancreas. We can check your liver with routine blood tests. Number 2 is that we may get imaging, whether it's an x-ray to see exactly what's going on. Maybe it's an ultrasound, which gives us a little bit of a better visualization. Or we can maybe get a CAT scan or an MRI, which gives us better imaging. And then lastly, I'm a GI doctor. I want to see what's going on myself. And so we may end up taking a look with a scope, either an upper endoscopy and or a colonoscopy. These are 3 things that we can do to find out what's going on when it comes to your pain. Let me know in the comments down below if you have any questions when it comes to abdominal pain, what the workup is, what we need to look out for as well. I'd love to hear what you guys have to think for that. All right. Dorothy, thank you for watching from Georgia. Oh, that's great. That's not the furthest yet. We had somebody from Australia, so not quite there yet, but thank you for watching. Joyce, is good seeing you. Trump is good seeing you. Jeanette, good seeing you. Debbie's good seeing you. Perfect. All right. So I think there was a live question that I had up on here. All right. Let me see here. There's a live question I saw in here. So Alex, you asked a question. You want to ask some tips on how to take a prebiotic and a probiotic to maximize the benefits. Great question. Well, I'll let you know. We'll be talking about that later on. But the best way to take a prebiotic is basically just any way. There's no optimal way to take prebiotics or probiotics. It's basically you want to incorporate that as much as you can into your diet. So what I mean by that is that if you can include this in everything that you're eating, you add a prebiotic with every single meal. You can consider adding a probiotic. You know my thoughts on probiotics. They're mainly marketing, very little science. But if you can certainly add as much prebiotics to every single meal that you can, that's going to be the best thing for you. Now, some probiotics, if you want to take them, just take the easiest one, typically once a day, unrefrigerated. Don't buy the most expensive. Don't buy the ones that have, refrigeration. The science behind that is very minimal, if best. But prebiotics for sure, eat this as much as you can. Add this to your diet every single meal. Absolutely recommend that. Let me know in the comments down below if you've tried prebiotics or probiotics, if you noticed a difference, or if you have a question about these as well. All right. Marley, thank you for watching from Jamaica. Oh, Jamaica, that's nice. I don't think we've ever had a Jamaica viewer, so I'm excited that we're there. Let's see. Perfect. Alex, Hong Kong. Okay, all right, you got us there. All right, I think that may be the furthest. Alex, I think you're going to get the prize for the furthest away from someone. All right, perfect. Question number 2. Dr. Islam, what are foods that cause bloating and what can I eat instead? The age-old question about bloating. All right, stay tuned because I'm going to do a full video on bloating, my tips, my foods I recommend, foods I avoid. Stay tuned for that. But to answer this question, what are the most common foods that causes bloating and what can I recommend as a substitute? Let's talk about this. Number 1, cruciferous vegetables. Say, what? What does that even mean? These are the greens like broccoli, Brussels sprouts, cabbage, the things that are healthy for us, but they cause a lot of bloating. And it's terrible. Look at me. I'm a GI doctor telling you to eat as many plants as you can, yet the plants that you eat will cause bloating. Hey, it happens to me as well. I cannot have Brussels sprouts. It is terrible. I'll tell you, my wife is absolutely so mad at me when I have Brussels sprouts. It is gas everywhere. They're healthy foods, but they may not be foods that we can take. So if that's the case, try to eliminate some of these cruciferous vegetables. You may want to substitute instead things like spinach, cucumbers, lettuce, sweet potatoes, zucchinis. These will give you the same effect in terms of benefits as having these other vegetables that are there. It's a very common problem that these cruciferous vegetables can cause a lot of bloating as well. Number 2, onions. Yes, you may have seen that tweet out there I saw on Twitter from Elon Musk saying to ban onions because it causes bloating. Absolutely. Onions are in everything and they provide so much flavor to our foods, but a lot of us are intolerant to onions. And that can be a really common cause for bloating. So instead, try some fresh herbs or spices as an alternative to really bring out the flavor in your food besides onions. Number 3, milk products. So many people out there are intolerant to dairy or have a lactose intolerant. In fact, you can get this as you get older. It happened to me. And you'd be surprised, you actually don't need dairy to have calcium and vitamin D. No, that's all about marketing. The amount of dairy that you need is minimal, and you get most of your vitamin D and calcium through foods, through vitamins, and even sunlight. But a lot of us don't realize that dairy is a trigger for a lot of our gut issues. So sometimes you can try other substitutes. Maybe things like lactose-free milk, almond milk, other milk products. These work great to help out when it comes to bloating and distension. Keep in mind, dairy is in a lot of products, not only milk, but cheese, ice cream, things like that. So don't just eliminate one thing and take something else that has dairy in it. Try to eliminate completely. Or take a lactate pill or an enzyme supplement to help you to metabolize that milk better so you could absorb those foods. All right, number 4, artificial sweeteners. What? Yes! So many of us don't realize that we cannot metabolize artificial sweeteners. It's like a bomb going off inside your stomach whenever you have these particular sweeteners. And it's in everywhere. Things like gums, sugarless candies, diet drinks, things like that. Splenda. These are artificial sweeteners that very commonly can cause gut issues. So what you need to do is that you need to try something else like erythritol. This is a artificial sweetener that's a lot easier to digest. And stevia actually is one of those substitutes which actually works a little bit better when it comes to digestion. So keep that in mind. Read the ingredients, kind of see what is going on there, and see if there are artificial sweeteners that are there. Number 6, this is Captain Obvious here, carbonated drinks. Okay, I am sorry, but if you are bloated, full of gas, guess what you shouldn't do? Introduce more gas into your stomach by drinking carbonated drinks. I know it's hard. I love my Dr. Peppers. I do. But if you're complaining of bloating and gas, you can't have carbonated drinks. You can't. You're just introducing more gas. And guess what I'm going to recommend to substitute? Water! Yes, good old water. Waters, teas, flavored waters. These are great alternatives. And I know it's hard to give up our soda drinks, but if you're complaining of bloating and you're putting more gas into your stomach, what do you think is going to happen? Number 6, this one, wheat or gluten. Yes, it seems like everyone in the world is trying to get rid of gluten. Let me give you the lowdown on this. Gluten itself is not the enemy. It is not. Carbohydrates are not the enemy. They are not. Now, there are some individuals that have a gluten intolerance that is real, that is legitimate. And there are others that have an autoimmune condition against wheat called celiac disease. Absolutely, it is very, very true. But you may be one of those that is actually gluten intolerant, and that's okay, not a problem. It's real. Easily just eliminate gluten and eliminate wheat and just see how you do. And what you can substitute instead include things like pure oats, quinoa, buckwheat, almond flour, and coconut flour. These are very effective alternatives when it comes to wheat. And then lastly, beans. Yes, beans. Listen, I live in West Texas. I love Mexican food. I love my beans. It is fantastic. But for me, beans can cause bloating as well. So kind of keep that in mind. Beans that don't cause bloating include pinto beans and black beans. And if you soak these beans in water, it tends to minimize the gas production. But these are the most common 7 foods that cause bloating and some of the alternatives I recommend to take instead. Let me know in the comments, have you noticed your bloating getting worse with these? Have you tried to eliminate these? Do you have anything else you would add to this list? I would love to hear what you guys have to say for that. All right, let me go through some of the live questions. All right, Marie Bailey, thank you for watching. Oh, we talked about that already. Rodney, perfect. So Toompa asked, very good question. How is Barrett's esophagus diagnosed and what are the symptoms? This is a great question. So Barrett's esophagus is a precancerous lesion of the esophagus, and this occurs from chronic acid reflux. Now, you'd be surprised to know that the most common people who have Barrett's esophagus are not those that are suffering from rip-roaring reflux. Oh, it's not those people that have reflux every single day. It's terrible. It's tearing up their quality of life. It's those individuals that tend to have intermittent reflux off and on, comes and goes. It's been going on for a long time. They also tend to be obese, male, and Caucasian as well. Now, the problem with Barrett's esophagus is that over time, this can progress into cancer of the esophagus, esophageal cancer. And so the only way for us to actually know this is to take a look and see what's going on. We do an upper endoscopy or an EGD. And with that, we put you to sleep. I use a very small camera and take a look inside the esophagus to see, is there damage that's consistent with Barrett's esophagus? And if there is, we'll biopsy to confirm that, because there are a couple of different stages of Barrett's esophagus that you can have. And depending on the stage, we'll determine exactly what we need to do for these patients. But for everyone who has Barrett's esophagus, we recommend a couple of things. Number one, you have to be on acid therapy. This is one of the very few conditions in which we do recommend acid therapy. Number two, you need to stop smoking and stop drinking. These are risk factors for esophageal cancer. Number three, you have to lose weight. Weight plays a role when it comes to acid reflux. And number four, you need to be on an anti-inflammatory diet. More plants, more vegetables, more fruits, less meats, less processed foods. This will help out tremendously when it comes to acid reflux and will help out tremendously when it comes to your risk for Barrett's esophagus. Great question. All right. Donna asked about broccoli. So what about cooking broccoli? Does it actually decrease the bloating? Unfortunately, it does not. Broccoli is broccoli, and broccoli causes bloating. It's just how it is. It's kind of terrible, but it's exactly how it is. Good. Perfect. So Joe, very good question. So you are a healthy 25-year-old man. Eat pretty clean, eat processed food now and then, you have lots of water, and you struggle with minor GERD. Okay, so Joe, I will tell you your problem, you're not alone. I have so many young individuals that have problems with acid reflux who are doing everything right. And this is the problem with acid reflux, is that you can do everything right. You can do all the recommendations. You can eat the right things. You can avoid the trigger foods. You can exercise correctly, and you can still have acid reflux. I feel like I'm the prime example. I have bad acid reflux. I don't eat bad. I exercise. I'm not overweight. I don't drink. I don't smoke, but I still have it. And this is the issue with acid reflux, is that it is not necessarily a lifestyle problem. The lifestyle does play a role for a lot of our people who have that, and it can be fixed. It can fix that, but also adjusting your lifestyle may not fix your acid reflux. So there are a couple things. Number one, we'd have to find out why. Why do you have acid reflux? Is it a sphincter problem? Is your sphincter open longer or more often? Number two, do you have maybe a hiatal hernia that's making that acid come up longer and more often? Number three, do you have poor emptying of the stomach? Maybe that's it. Next number, maybe it's producing of too much acid. And there are a couple of options that we can do, whether it's medical therapy, whether it's natural therapy, things like mastic gum works fantastic, whether it's surgical therapy to help out with what's going on. And depending on what we see and depending on our work, it will allow us to determine what the next steps are for you. But I'll tell you, Joe, you're not alone. Let me know in the comments down below if you're like Joe, if you've had issues like this, you've done everything right and you've had acid reflux, and what have you tried to help out with your acid reflux? Comment down below. I would love to hear what you guys have to say on that. Great question on there. All right. So last question I got. Hey, Dr. Islam, what is the difference between a prebiotic and a probiotic? So let me know in the comments down below if you've wondered this, if this is a question you guys have had as well, because it's very important for us to really have a good understanding of what a prebiotic is and what probiotics are. So prebiotics are foods or substances that improve or enhance the guys that are inside your GI tract. In your gut, you have what's called the microbiome. It is trillions and trillions of bacteria, yeast, fungi, viruses that are constantly interacting with each other to produce all sorts of substances to help us live, to help us metabolize, and to break down nutrients. And sometimes these good guys, they need a fertilizer. They need an energy source to improve the quality of the type of bacteria that's being made, but also improve the quantity of the good guys that are there. And prebiotics are fibers, natural fibers, that we cannot make on our own, that we typically ingest to act as the fertilizer to improve the good guys. And this actually enhances what is going on there. The best prebiotics are fibers, and the best way to get the best amount of fiber is to eat a wide variety of plants. By far, this is the number one way you can improve your gut microbiome more than anything else you can do, and it is the number one way to give you the maximum number of prebiotic supplementation that's there. So foods that are high in prebiotics include obviously plants, so as much plants as you can have, and the best variety you can have is going to be the best thing. What are probiotics? So probiotics are live organisms you add into your gut microbiome to add as reinforcements to the guys that are there. Now, we don't have a lot of good science behind probiotics. We just don't. In fact, it's a lot of marketing and a lot of myth making with very little science behind it. Now, having said that, there are some individuals which may benefit from taking a probiotic, whether it's a probiotic supplement or probiotic foods, because it just adds on to what's going on there. But what I'll tell you is that it adds as reinforcement, but if the guys already there are not doing well, having a little bit of reinforcement is not going to affect or change anything inside your GI tract. But these are the main differences between prebiotics and probiotics. I'm a huge fan of trying to increase the amount of prebiotics in your diet by increasing the diversity of plants. Probiotics are okay. Very little harm. They can be expensive. Be careful of that. And also, too, keep in mind that probiotics may not help everyone. And I always have to stress this when it comes to individuals as well. All right, guys. Perfect. All right. All right, guys. Well, it's almost been an hour, 30 minutes, so I'm going to have to go. I want to thank you for watching today. If you haven't already, don't forget to smash that like button. Like, share, and subscribe. And if you haven't already, don't forget to subscribe to my channel where you get great tips and tricks like you're learning in this video. If you want to know when my next live video is, don't forget to subscribe to my channel. I'll put out announcements. Look on my social media channels, Facebook, YouTube, Instagram, hopefully TikTok soon. Keep in mind. I look forward to seeing you guys in about 2 weeks. Hope you guys have a happy and healthy day. Thanks, everyone. Take care and have a great day. Thanks, guys.